Hello and welcome to my presentation for physiological psychology on transcranial direct current stimulation and the effects that it has on major depressive disorders. Transcranial direct current stimulation is a form of neuromodulation that uses constant low direct current delivered via electrodes to the head. It was originally developed to help patients with brain injuries or psychiatric conditions like major depressive disorder. It is a very old technique mentioned more than 200 years ago. The direct current is delivered by a pair of sponge electrodes moistened with tap water or sodium chloride solution. Recent studies suggest that a medium sodium chloride solution is suited to minimize discomfort. The current density delivered is between 0.029 and 0.08 milliamps per centimeter squared, which causes a slight itching sensation at the beginning, which generally fades. The application I'll be reviewing in conjunction with transcranial direct current stimulation is major depressive disorder. Currently in Australia, 1 in 7 people are expected to experience depression at least once in their lifetime, and it is almost guaranteed that someone you know is suffering. The main characteristic of major depression is a low mood that is felt most days of the week and lasts for at least 2 weeks. Depression has many causes, like the ones listed, as well as other mental health conditions such as bipolar. Depression doesn't discriminate and can affect anyone and everyone, but is more likely to affect people who live in remote and regional areas and Aboriginal and Torres Strait Islander people. There are many signs and symptoms to depression. Some of the ones listed are the most common signs that people can notice, as well as thoughts of self-harm, difficulty sleeping, and reliance on alcohol or medication. A physiological mechanism is the way in which the organ systems of the body function. An example of this is the behavior of an animal, including human beings, is one of the functional outcomes of the brain. Physiological mechanisms explain any health-related events or outcomes. Research suggests depression doesn't spring from having too little or too much of certain brain chemicals. Rather, there are many possible causes, including faulty mood regulation in the brain, stressful life events, medications, medical problems, and many others as previously mentioned. Researchers believe important levels of brain chemicals have a major impact on depression, such as nerve cell connections, nerve cell growth, and the functioning of nerve circuits. But they still believe that understanding of the neurological underpinnings of mood is incomplete. So with this level of complexity around the level of brain chemicals and the possible cause of depression, it is hard to determine what treatment will work best for two people who might have similar symptoms but differ on the inside. The electrical or magnetic impulses that are used during transcranial direct current stimulation, which is classed as a non-invasive stimulation technique, affects the brain function with modifications to perceptual, cognitive, and behavioral functions. This means that this technique acts on the brain physiology without the need for surgical procedures involving electrode implantation, such as deep brain, direct cortical, or epidural stimulation techniques. Over the past 15 years, some major physiological effects that have been reported from animal and human studies of basic mechanisms of transcranial direct current stimulation include subthreshold polarization of neuronal membranes and glutamatergic plasticity, as well as spontaneous neuronal activity and regional plasticity effects of cerebral networks. Some similar effects were found between transcranial direct current stimulation and transcranial near-infrared light therapy and repetitive transcranial magnetic stimulation, in that they were used for cognitive enhancement in normal healthy subjects. Transcranial direct current stimulation techniques, however, appear to exert hermetic effects on the subjects, whereas transcranial near-infrared light therapy has been used to improve memory in animal subjects and improve cognitive function and mood in healthy human volunteers. A lot of testing and research has been done on animal subjects, which has shown in recent studies on rabbits that transcranial direct current stimulation has modulated presynaptic mechanisms of transmission, and a sustained direct current has been shown to produce acute and lasting changes in oscillations in brain slices. Early reports of transcranial direct current stimulation trials found that it caused headaches, itchiness, and redness of skin under the electrodes, but also included descriptions of burns to the skin under the scalp electrodes. But this has not been reported since researchers started using sodium chloride saline rather than water to soak electrodes prior to use. Some of the literature also reported that there were several cases of transcranial direct current stimulation associated hypomanic episodes, which is an emotional state characterized by a distinct period of persistently elevated or irritable mood that lasts throughout at least 4 consecutive days. The literature also talked about a scale used to test how transcranial direct current stimulation affected major depressive disorder called the Hamilton Depression Rating Scale. This showed that the active treatment group showed greater improvement in mood by a reduction of 58% compared to the sham group, which only reduced by 13.1%. The testing for the Hamilton Depression Rating Scale was that both groups were exposed to transcranial direct current stimulation, but after 5 seconds, the sham group had their machine turned off, whereas the active group were given the full treatment. Based on the experimental data conducted, theories have been advanced to explain transcranial direct current stimulation mechanisms, although we currently lack an explanatory framework that has been accepted by the research community. In fact, majority of the trials with transcranial direct current stimulation are rationalized simply by placing an electrode over a target region and assuming based on the polarity of the electrodes that brain function will be altered. This rationale ignores the complexity of the dose, issues regarding the physics of the brain current flow, complex relations between cortical activity and performance, and treats high cognitive function and disease as a sliding scale rooted in one brain region. The meta-analysis of transcranial direct current stimulation for depression yield inconsistent conclusions, possibly due to a number of factors. The first factor was the choice of outcome measures for calculating the effect size. One study used a percentage to measure depression rating change, whereas another study used a categorical response. The second factor is that another study, which recruited participants with highly treatment-resistant depression, including those who failed to respond to treatment, who were excluded from earlier trials. Further research is needed, in particular involving large sample sizes over longer periods of treatment to give better results. Further research will also be required to better explain the mechanisms and relative effectiveness of these approaches in producing defined neurocognitive and behavioral outcomes. Thank you for watching and listening to my presentation on transcranial direct current stimulation and the effect it has on major depressive disorder.